one of our doctor friend, Dr. Sagar Pusti, is the HOD Anatomy Department, MKCG Medical College. I have also given this link to him. Probably he may join, sir.
He must be like senior of Saroj only.
Definitely, definitely.
Yes.
In fact, sir, we need that kind of thing, like, from you all, like you all can share this link and everybody can have that kind of benefit, of this kind of talks. So this is what we are also thinking of. Thanks for sharing.
Okay. Thank you.
So I would like to welcome you all to the talk on organ donation organized by KVS Delhi NCR. On behalf of the entire office bearers and executive members, the governing body, I'm thankful to you all to have shown interest. Yeah, next slide, please. So the agenda today would be simple. I'll talk about organ donation just as a precursor. Since I was traveling, I had recorded my presentation, which would be broadcast immediately after this slide. And after that, we'll go to the our expert, Dr. B. Saroj Prusti. We are thankful to him for having accepted our invitation and to share his pearls of knowledge. Please come back to the, So after Dr. Saroj finishes his talk, you may please ask your questions and there'll be a question and answer session. After the Q&A session, our KVS secretary and joint secretary, they'll make some announcements about our activities and the forthcoming events. Some recognitions are there in line, and the program will end with a vote of thanks by Dr. B. Ganesh Prusti, our Vice President. Yeah, please, next. So here is a little curtain raiser to the entire subject. Can you please play the recording, Satish ji?
Yes. Sir, everybody able to see screen, na?
Yes, yes.
Okay, thank you.
The sound is not coming. Satish ji, we can't hear it. Yeah, you just have to pull it up and restart it. Yeah. Yeah. We still can't hear.
We'll check it, sir. 1 minute, just I will check.
No. We can't hear. Should I try
Satyaji,
playing it
no,
from my
still we cannot hear.
machine?
Yeah, Kotni sir, if you have that,
Yeah, I
you
have it.
can try that. Yeah, please,
So
please,
you
sir,
will
go
have
ahead.
to, yeah, you'll have to give me the permission to play it. You'll have to disconnect yourself, Satish ji. And I'll share my screen then. Satish ji.
I'm doing, sir. I'm doing.
Yeah.
Sir, I have given option to you. Can you try now?
But then your screen is still coming. Your screen
Sharing
has to, you have to stop sharing, then I can
Yeah.
share.
Okay, sir. Sir, now you can try.
Just a minute. Is it visible, my screen?
Yeah, yeah.
Namaskar to all of you. I am Srinivas Kotni, President of KVS.
Is it audible?
Yes, sir, we can hear you.
Yes, audible.
Yeah, Kalinga Vaishya. Welcome to you all for this session on organ donation. I'm going to make a small presentation. Before that, I would want to thank especially Dr. Saroj Kumar Prushti for agreeing to talk to us about how to donate organs, right? So I'll be setting the context by talking about organ donation. So I made a brief presentation, which I'm going to present right now, a very brief one, just to put the context. So let me share my presentation. Yeah. So the presentation today we are having is on organ donation, as you all know. It'll be very brief and crisp so that I don't eat away much of time, but I'll try to cover as much ground as possible. Now, the flow of presentation will be like this. I'll introduce organ donation to you all. I'll talk about what is organ donation, the need for organ donation in India, the demographies surrounding organ donation, the legal aspects relating to organ donation, the process of organ donation I'll briefly touch upon, and I'll leave it for Dr. Saroj to talk about it. Then I'll talk about myths and misconceptions around organ donation in India and otherwise also. Benefits of organ donation we'll touch upon briefly. The challenges as a country we are facing and the solutions around those challenges, and some success stories, all relating to India, and in conclusion. So this will be my structure of presentation today. Now, in introduction, organ donation is nothing but a process of donating organs, tissues, cells from a living or a deceased person to save or improve the life of another person. It is basically to save lives. We all know that every day many people die in a country due to lack of organs which are available for transplantation in hospitals and at various locations. Organ donation is a way to bridge the gap between the demand for organs and the limited supply, because all are not donors. So organ donation is an act of selfless generosity, which can give a new lease of life to someone in need. So we all recognize that. We should recognize that. Organ donation is a complex process that involves medical professionals, government agencies, NGOs, all working together to promote the transplantation and donation. It's a very sensitive and emotional topic, and it is important to address the myths and misconceptions surrounding it. Now, what is organ donation? That question might come to your mind. It is a process of surgically removing organs, tissues, or cells from a living or deceased person and transplanting them into another person who needs them. It involves a donation of vital organs, such as heart, liver, lungs, kidneys, pancreas, as well as non-vital organs such as skin, bone, corneas, etc. The interesting fact is the organ donation can be done by both living as well as deceased donors. Living donation involves donating an organ or tissue while the donor is still alive. This can include donating a kidney, a portion of a liver, bone marrow, etc. Deceased donation involves donating organs after the donor has died, but the organs are still viable for transplantation. It means that there's a time gap within which Dr. Saroj would elaborate on that. Organ donation is a highly regulated process. Strict medical and ethical guidelines are prescribed and need to be followed to ensure that donation and transplantation process is safe and effective both. The decision to donate organs is a personal choice, and donors can choose which organs they want to donate and whom they want to donate. Everything they can prescribe in the donation forms. Now, what is the need for donation of organs in India? The thing is, India has got a huge demand-supply gap when it comes to organ donation. According to estimates, around 5 lakh people die in India each year due to non-availability of organs for transplantation. The demand for organs is increasing every year due to the rising incidence of organ failure and chronic diseases such as diabetes, hypertension, kidney disease, etc. There's a huge waiting list for transplantation in India, and it's very long. The patients often have to wait for months and sometimes years to get a suitable donor or a suitable organ. There's also a lack of awareness about organ donation. There are misconceptions and religious beliefs around organ donation, and there's also a shortage of infrastructure and trained medical professionals. These are challenges which are plaguing the organ donation canvas in India. The need for organs is particularly high among marginalized, economically disadvantaged sections of society who often cannot afford the cost of transplantation or access to quality healthcare facilities. So therefore, the poor, there's a large cross-section of poor population, and that also is an impediment. It can save a lot of lives, improve the quality of life for patients suffering from such failures of organs. By donating organs, we can all leave behind a legacy of hope and compassion. These are some statistics around organ donation, some demographies. I'm not getting into it, but you can just note these statistics. There are some legal aspects to organ donation in India. There's an act called Transplantation of Human Organs and Tissues Act 1994, and also Transplantation of Human Organs and Tissues Rules 2014, which cover the organ donation, the landscape in India. The THOTA, that is the act, it aims to regulate the removal, storage, transplantation of human organs and tissues for medical purposes, that is therapeutic purposes, and prevent commercial dealings in organs. So we all have heard about commercial dealing in organs, organ selling, rackets, etc. All those things are prohibited and governed under this act. This act allows organ donation from brain dead donors, living donors, cadavers, that is after one is dead, and outlines the procedure for the organ donation and transplantation. So this act is a legal umbrella under which the organ donation operates in India. It also establishes a national organ and tissue transplant organization, which is also called NATO, which is the apex body for coordinating organ donation and transplantation activities in the country, in India. This act prohibits commercial dealings in organs and prescribes stringent penalties to those who are found guilty of violating the provisions of this act. One can go to jail. There are heavy monetary penalties. I'm not delving into it in detail, but the act deals with it. The Act also provides for setting up of an authorization committee in hospitals to oversee the process of organ donation, to ensure that it is done in a transparent and ethical manner, both donation and transplantation. Coming to the rules, these provide detailed guidelines on various aspects of organ donation and transplantation, including the criteria for brain death certificates, the process of organ retrieval and transportation, and the consent process for organ donation, because consent is the king here also. So these are some legal aspects surrounding organ donation in India. As far as the process is concerned, I have laid down the process in steps. You can take a screenshot of it. I'll be leaving it to Dr. Saroj to talk about the procedure and the process in a more detailed manner. There's some myths and misconceptions around organ donation. Some of these common myths are that the doctors will not try to save a life if they know that the patient is an organ donor. I don't think that that happens. It is a completely false statement. They have a legal and ethical obligation to do everything possible to save his patient's life, whatever the status of the donor is. The other myth is that religion prohibits donation of organs, or the culture prohibits it. I don't think anything of that sort is there in any religion. And in fact, most of the religions and religious leaders come forward and promote organ donation because of its altruism and compassion, because it shows compassion towards other human beings. There's another misconception that if the organs are taken out from a body, then the dead person will not be able to have an open casket funeral. This is always done with explicit consent of the donor and the family. We all know that. And we also should note that the donor's body is treated with utmost respect and dignity. So therefore, somebody who has done such a genuine and bona fide act of donating one's body and parts, he or she deserves such kind of a dignified process. There's also a misconception that only young and healthy people can donate organs. No, this is not true. Health is not the only criteria. Age is not the only criteria. Even old persons can donate certain organs and tissues. So therefore, please don't have these myths and misconceptions. Some people also believe that organ donation is a costly affair, and they or their family members have to pay for the transplantation. This is wrong. The entire transplantation, organ retrieval cost, everything is borne by the government or the hospital. The Act provides for that, and there's a fund which is there. So we'll not get into the depth of it, but then one needs to know this fact, and myths need to be wiped out from our minds. What are the benefits of organ donation? It definitely saves life. You can give a new lease of life to someone who is suffering from a life-threatening disease or disorder. They can be organ failures. So we are providing that kind of a platform where they can get the organs. It also gives a quality of life for the recipient, because somebody who's suffering from a chronic disease or chronic organ failure, etc., can lead a normal and fulfilling life once the organ transplantation is done. It can also have a very positive impact on donor's family. Knowing that somebody whom you love has saved or improved the lives of others can elate you, and you will have a different kind of a sense of fulfillment in those difficult times when you're mourning. It also promotes a culture of compassion and altruism in the society. It inspires others to consider organ donation, and it encourages and creates a ripple effect of generosity and kindness. So therefore, even, when I'm talking about organ donation, the compassion and generosity and kindness is oozing naturally. So therefore, I think most of you who are listening to it also would have the same feeling. I believe so. It also advances medical research and knowledge. Many people donate their bodies for medical institutes or hospitals for study. So that research can happen, diseases can be understood in a better manner, organ functioning can be explained to students, new treatment and therapeutical methods can be found, etc., etc. It can also reduce healthcare costs transplantation is often a more cost-effective and sustainable solution than long-term medical treatment for organ failure. So these are the benefits. Now let us come to the challenges and solutions. What are the challenges for our organ donation in India or anywhere in the world? There's lack of awareness and education about organ donation among the general public. There's shortage of trained medical professionals and infrastructure for organ retrieval and transplantation. There's a stigma and misconceptions around organ donation transplantation, which we have seen a few slides back. The ethical and legal issues surrounding it. There's a lot of time process. I mean, people don't want to wait to go to hospital in the time of grief and to fill in 110 forms. All these things are challenges. What are the solutions? Education programs, awareness programs, mass media campaigns, community outreach programs, public education initiative. What we are doing right now is also one such initiative. Then the other solution can be strengthening the healthcare infrastructure and investing in training and capacity building for medical professionals for organ retrieval and transplantation. The other aspect is to address stigma and misconceptions through targeted communications and awareness campaigns throughout India, which will benefit donation and transplantation of organs. We also should look at improving access to healthcare for all through government policies and initiatives that prioritize equitable and affordable healthcare for all citizens. The final one is to address ethical and legal issues through implementation and enforcement of strong regulatory framework and ensure transparency, accountability, and ethical practices in organ donation and transplantation, and also to hit at the rackets, organ donation rackets, by implementing the act in a more benevolent manner so that things can work. Laws are there, but the implementation has to be better. There are many success stories surrounding organ donation. So in 2018, this 27-year-old woman from Mumbai became the first person in the city to undergo a heart and lung dual transplant. The organs were donated by a brain-dead patient. The surgery was successfully performed at a hospital in Chennai. Similarly, in 2019, a 14-month tiny baby from Hyderabad became the youngest patient in India to undergo a liver transplant. The liver was donated by a baby's mother. The surgery was successfully performed in a hospital in Bengaluru. Look at the geographical cross cooperation. In 2020, a 53-year-old man from Pune became the oldest person in India to undergo a heart transplant operation. The heart was donated by a brain-dead patient again. The surgery was successfully performed in a hospital in Mumbai. So Pune, Mumbai, Hyderabad. Just look at cities. In 2021, a 48-year-old man from Kolkata became the first person in East India to undergo a pancreas transplant. The pancreas was donated again by a brain-dead patient. The surgery was performed in a hospital in Chennai successfully. In 2022, a 30-year-old man from Delhi became the first person in India to undergo a combined liver and small bowel transplant. The organs were donated by a brain-dead patient, and surgery was successfully performed in a hospital in Delhi. So these are some success stories which showcase the potential and impact of organ donation and transplantation and highlight the importance of continued efforts to promote and improve organ donation in our country. So we should all look at this. There are thousands and thousands of other success stories. I've just picked up a few just to motivate all of us to participate in organ donation as an activity. In conclusion, I must say that it's a noble act which can save lives and improve the quality of life for those suffering from organ failures. We in India face a lot of challenges around organ donation and transplantation, which are like awareness issues, infrastructure issues, ethical and legal issues. There are also, on the other side, there are many success stories which we have seen, some of them, which demonstrate the impact and the potential organ donation and transplantation can have on a society. So we need to promote awareness, invest in infrastructure, training, etc. to, to deal with the organ donation issue. So I think I conclude with this, and thank you so much for patiently going through my presentation, which I put together just as a precursor to Dr. Saroj, who will handle the more practical aspects, the procedural aspect, the steps involved, etc. Thank you so much, and over to Mr. Saroj. Thank you.
Shall I share my screen?
Yeah, Satish ji, please
Yeah.
share your screen. Yeah, Dr. Saroj, you
Yeah.
have a presentation which you have made.
Yeah, I'm having my presentation.
Yeah, Satish, can you enable him to?
Yes, sir. I have. He has the privileges.
Right.
Yes.
Uh,
Dr. Saroj, before you proceed ahead, hope I have not committed any mistake in any of my, because I am a non-technical person.
no, sir. You have everything you have covered. Most of the things you have covered, sir.
Thank you, sir. Thank you.
Today, video presentation.
So, on the bottom, you can play.
Yeah.
You have to bring the cursor down and then place her on this. Yeah.
Yeah. Good evening, everyone, and namaste to everyone. First of all, I'm highly grateful to Mr. Srinivas Kotni sir, the president of KVS, and I'm highly thankful to the organizing committee because for giving me opportunity to discuss regarding the organ donation, which is a very, very important, highly important. And I appreciate for choosing this topic by the organizing committee because the awareness among us as a public regarding the organ donation is very, very poor. As Sir has already discussed regarding just he must almost touched each and every point of the organ donation part. So which is very, very important among us as a public to know about what is going on and in India and how we need to improve in that aspect so that we can help the people who needs transplants. So let us discuss regarding the process of organ donation and how to donate it. So I will cover the topic in a questionnaire format. So some of the questions, I will raise the questions and most of the part of the topic, I'll cover it. If anything is in doubt, later we can discuss after finishing my talk. So the organ donation is basically a retrieval process of the organ from the or a biological tissue and transplanting into a living recipient. So who is need for the transplant and what is brain death and how it is related to the organ donation, everything we need to know about the organ donation. So different types, what are types of organ donation? So there are, as are mentioned, live organ donation, cadaveric organ donation, or a decayed organ donation. The live organ donation is when we retrieve an organ from a living body, we call it as a live. And when we retrieve an organ from a cadaveric or decayed body, we call it as a decayed organ donation. But here, if patient is dead, how to retrieve an organ? So there comes two definitions, two types of death it comes. The question comes here, is a patient is dead, how to retrieve an organ? So for that reason, they have divided into two types of death. So one is brainstem death, another is cardiac death. So the brainstem death where patient is completely unconscious or irreversible coma, we call it as irreversible coma, where the cardiac function is intact. So circulation is intact in the body. Whereas in cardiac death, so patient is already dead, all organ functions are dead, and you cannot retrieve organ from the body. So basically, as per the medical legal law, both are declared as a death, either a brainstem death or a cardiac death, both are considered as a death only. But for organ donation purpose, the definitions are being made different because the circulation is intact and heart is intact by giving different supports in a cadaveric organ. So brainstem, what is brainstem death? We will come into discussion. What is live organ donation? So live organ donation is an important aspect. Those people you might be knowing in India or everywhere, the most common organs, the live organs are like kidney or liver, because the most regenerative power of organ of the body is liver. Even if you remove a part of the liver, the patient, the donor, again, the remaining part of the liver will be regenerated within a period of few months. And patient will not suffer, the donor will not suffer anything. And kidney, if somebody donates one kidney, so that it will not affect the donor anything in any way, because another single kidney is sufficient enough for the body to survive. So like that. So who are the people who can donate? Basically, it is divided into two groups. There are near relatives, another is distant relatives. The near relatives are the people who, like your spouse, the daughter, son, your brother, sister, parents, your grandparents, and grandchildren. We call them as a near relatives. All others, friends, are distant relatives. What is the difference? Because for the near relatives, you need not take any permission from the authority. Whereas for the distant relatives, you need to take permission before donating the organ. So that is the difference for live organ donation. Coming to, now question comes, which organs and tissues can be donated? So the organs, as are told, 6 organs are very, very important, which are kidney, liver, heart, lungs, pancreas, and intestine, which can be donated. But what is difference in live and cadaveric donor? In a live donor, as we have discussed, so somebody can donate a kidney and liver, but heart cannot be donated by a live donor. Lungs, part of the lung or a lobe of the lung can be donated by a live donor. Part of pancreas and part of intestine also can be donated by a live donor, but mostly we'll see the pancreas, intestine, lungs, and heart are by the cadaveric donors. Whereas kidney and liver is more common by the live donors. And coming to the, so here you remember, if you might have heard, there are so many transplants are happening. The one cadaveric donor will save 9 lives. You might have heard 9 lives. So how it affects the 9 lives? We are giving 6 organs, our life. So because the kidney can be given to 2 people, the liver can be divided into 2 people, and the lungs can be divided into 2. And other 3 if you include. So you can give, if a single donor, deceased donor, can give to 9 people who are required transplant. And regarding the tissues, the cornea, skin, bones, muscles, tendons, ligaments, different veins, cartilages, and heart valves in different conditions also can be retrieved from the body, deceased donor, which is usually even you can do in a cardiac death or you can do in a cadaveric death. But in India, the cardiac death, retrieval of the organ is not being practiced. As per the law, it is not allowed. So it is only the cadaveric donor or brainstem death, you can take these organs after the declaration. Then what is the process of organ donation? The living organ donation process, usually they will come, once there is an indication, a kidney patient, indication for a transplant, they undergo different medical tests for the medical compatibility testing, and there is a document verification of the donor and consent and retrieval of the organ and transplant is done. Whereas in a deceased donor donation process, basically the brainstem death declaration is very, very important. So after declaration of the brain death, only the things can be proceed. And after that, the family consent is very, very important. Unless patient family gives consent for retrieval of organ, you cannot retrieve the organs. And after that, you need a police clearance or no objection certificate and forensic medical expert opinion, and then retrieval of the organ and giving to the transplant patients. Now, what are the law governing organ donation in India? There are Transplantation of Human Organs Act, as are mentioned, which was introduced in 1994. Then again, there was revision in 2014. The law was related to the removal, storage, and transplantation of the human organs for therapeutic purposes and to prevent the commercial use of it. So for that reason, different organizations are there which coordinates and process in India. So you might have heard NOTO. NOTO is a National Organ and Tissue Transplant Organization, where head center is in New Delhi. It is in the Safdarjung Hospital. So they have a head office there. And ROTO is a regional organ and tissue transplantation organization. There are 5 regional transplant organizations, and in throughout India it is there. And there are state nodal agencies. Different states have a different agencies. And like in Telangana, there is a Jivandan Foundation, which is a state nodal agency, make waiting. So what is their purpose? To make waiting list for the patients and to monitor the allocation process for the patients, because the list will be very long. So they have to maintain a waiting list. So once declared and consent is taken by the donor hospital. So different in throughout India, there are about 550 hospitals, transplant hospitals, or means where the organs can be retrieved and transplant can be done in the transplant hospital. Around 140 hospitals where only the organ can be retrieved, but transplant cannot be done. So the retrieval organs, again, we have to send to the transplant center. So like that, so the once declared and consent taken by the donor hospital, the organs which are can be transplanted to the recipients. So out of which organ to be kept in the same hospital and which organ to be sent to the pool in the state agency. So like that, kidney and lungs, because it has a two organs, so one kidney, one lung has to go to the pool. Whereas the liver, heart, intestine, and pancreas, which those organs can be kept by the same hospital if they have a recipient. If they don't have a recipient in the donor hospital or a transplant hospital where the body is declared, brainstem is declared. So those, if they don't have a recipient, they can again give these organs to the pool, where the list is being maintained by the pool, state nodal agency. They will allocate these organs to the pool and to the different hospitals, and the own hospital, the different transplant hospitals, they will maintain their again separate waiting list for the different organs. So in that way, the process occurs for the allocation of different organs to different hospitals. So what is brain death? Now coming to the pure topic, because brain death is an important part of this one. Unless we declare brain death, we cannot get the organs. And the frequency, the number of brain death cases in India is very high. Because of accidents, road traffic accidents is the most common. Around 1.5 to 1.8 lakhs accidents, the patients die because of road traffic accidents. And the brain deaths occurring, a lot of brain deaths because of some unawareness among both sides. The declaration part and acceptance part, both are lacking. Because of that, organ donations are not happening in what is as per the expectation. So for that reason, it's a very important topic for the awareness among the public and the medical fraternity, that brain death declaration, when to declare and how to declare, and what are the formalities are required. So to say brain death, we need to document patients should have a irreversible coma and irreversible loss of brainstem reflexes and cessation of respiratory center or spontaneous breathing. Patients should not have a own breathing. Patients should have a loss of brainstem reflexes, and patients should have a irreversible coma. These three things are mandatory, and demonstration of cessation of the intracranial blood flow, if you are able to demonstrate, that also can give a confirm that person is having brainstem death. But that is not a part of the act. So, and it is not mandatory also. So, for that, irreversible cessation of cerebral and brainstem characterized by absence of electrical activity in the brain, absence of blood flow to the brain, and absence of brain function determined by clinical assessment. So, how to go ahead with the clinical assessment? Before that, just for awareness, I want to say just few words. In a normal brain anatomy, the consciousness level is being maintained by, there are two things, cerebral cortex and reticular activating system and brainstem. The brainstem consists of reticular activating system, and cerebral cortex is the main important part of the brain, which maintains your consciousness function. And the brainstem is midbrain, pons, and medulla. These three parts of the brainstem, because the important vital centers like respiratory center and cardiovascular centers are present, and different important nucleuses and cranial nerves are present in these parts of the brain, which is very, very important to sustain the life. And when there is a loss of supply of the blood to these organs, these parts of the brain dies. And when neuronal damage occurs, they don't survive. And there is no regeneration, and it becomes an irreversible damage. So the procedures for the brainstem death confirmation or declaration needs three essential steps. The documentation of coma, we need to document that patient is having coma, exclude reversible causes and documentation of the absence of brainstem reflexes, and documentation of apnea. Apnea means absence of breathing. Then first prerequisite for brainstem death confirmation, rule out any reversible causes of the coma. So here I want to tell you one thing. The irreversible cause of coma is to be determined when any patient is unconscious or comatose. The cause should be ascertained first. If we don't know the cause for the death, cause for comatose condition, then you cannot proceed with the brain death declaration. So cause should be, so first most important part is, for that reason, we are taking road traffic accident or brain injury patients as a first priority, because we know that because of accident, there is injury to the brain. And because of injury to the brain, we know that is the cause for death, brain death. So in that way, suppose you don't know a case of encephalitis, viral encephalitis. When you don't know the cause for the virus, in that situation, you cannot take the proceed for the declaration of brain death when you don't know the cause. So next is exclusion of reversible causes. Reversible causes is like different poisonings, alcoholic intoxications, drugs, and different sedation and neuromuscular blocking agents, severe hypothermia, severe shock. These are some medical causes are there which are reversible. So those conditions also to be ruled out before declaring patient in coma. Then coming to assessment of brainstem reflexes. As we discussed, midbrain, pons, and medulla, that part of the brainstem, they have different centers. We test medically, different tests are there to say that brainstem reflexes are absent, so that patient is brainstem death. So different reflexes, it's maybe all non-medical person, it's difficult to understand, but still just in an important way, I want to convey you. We look at pupillary response to the light. So we put some light over the pupil, so we see for the response. When patient is dead, there is no pupillary reflex. Otherwise, the pupils will constrict. That in a normal person, you will be able to see. And coming to doll's eye movement. So in a normal person, the eyeballs will move if you rotate the head. But in a brainstem death patient, if you move the head also, there will be no rotation of the eyeballs. So we call it as a doll's eye movement. Then coming to corneal reflex. if you put a small piece of cotton over the cornea, so there will be blinking of the eye, we call it a corneal reflex, which is absent in the brainstem death. Painful stimuli, if you give, there will be no response. Cough and gag reflexes will be absent in brainstem death. And if we do vestibular like calorie testing, there will be no eyeball movement. So these are all some brainstem reflexes which you can see by doing physical examination. Another is apnea test, as we discussed, spontaneous breathing trial, means whether patient is having own breathing or not. So in that situation, when patient is already on support, mechanical ventilator support, we disconnect the ventilator and see whether patient is having spontaneous breathing or not. So how to know about it? So usually you look for carbon dioxide is rising or not. If there is a rising carbon dioxide after disconnection of the mechanical ventilation, it means that patient is not able to breathe. Spontaneous breathing is not there. In that situation, we say that apnea test is positive. So we do apnea test only after documentation of coma and documentation of absence of brainstem reflexes. So, and we do a checklist for prerequisites for brainstem death declaration, different checklist as we have discussed related to the etiology. And even documentation of apnea test also we do, as already have described. Now, once the specialist completes the test, the time of death is confirmed at the end of second examination time. So there are two things, the documentation of coma and documentation of absent brainstem reflexes. We document for 2 times with a 6 hours interval, and apnea test we do with a 6 hours interval 2 times. And the second apnea test, when we declare that all these things are positive, then we say it is a brain death, and at the time of death we write the death time is second apnea test time. Then coming to confirmatory, there are some other confirmatory tests, but as per the law, Indian law, these are not mandatory, like cerebral angiography. If you do a cerebral angiography, so you see, look at this picture. In a normal person, if you do a inject and dye and see that there is a blood vessels will be visible. Whereas in a brain death, there will be no visible blood vessels because there is a loss of circulation to the brain. So that is usually confirmatory test, but not required or not mandatory as per the Indian laws. So why we need for Indian law to recognize brainstem death? Continuing brain death person on ventilators may include potential harm if we don't do organ donation. If purpose of organ donation is there, we can continue on the supports. If there is no purpose of organ donation, we should not continue on the supports. We should declare, we disconnect everything, hand over the body to the family, because that may lead to different complete potential harms. It lead to mistreatment of the dead, provision of false hope, prolongation of the grieving process, undermining the professional responsibility of the physician to achieve a timely and accurate diagnosis, anticipated societal harm arising from the negotiated and inconsistent standard of death determination. So then coming to who does the testing and when does the testing? The testing is done by 2 doctors at an interval of 6 hours. A doctor is a neurophysician or intensivist or a neurosurgeon or an equally qualified doctor who is certified to be on the hospital brain death panel. And 2 more persons are observed, process and sign in the final document, primary physician on the hospital administrator. So total, there are 4 people who sign the document of declaration of the brain death. Now, what happens once the brainstem death is declared? So once brainstem death is declared, if you look at the step, so certainly once brainstem death is declared, the consent for organ donation, they are giving or not. If patient is giving organ donation, the family is giving organ donation consent, then we need to continue with supports till the retrieval of the organs, and no consent, termination of treatment. But before that, the transplant coordinator is an important person in every transplant hospital. There is a transplant coordinator who coordinates, who discusses with the family regarding the organ donation. And he takes consent from the family. And then police NOC is required and post-mortem in the medical legal cases, because most of the cases are trauma cases. So you take a medical legal post-mortem, and then we send the patient to operation theater for retrieval of the organs, and body sent to forensic department for post-mortem, or if nothing is there, handing over to the family. So that's once the brainstem death is declared, whose signs already we have discussed. And there is a form number 10 also, it is declared by the person. Another is form number 8, which gives consent by the family. That is form number 8. And the management of brain dead donor, because once the patient family gives the consent, we need to optimize the organ function, because that is the very important time, because graft viability, you have to maintain the circulation, to maintain circulation to the organs, so that till we remove the organs for donation, that everything is viable. So we manage different temperature, usually patient's temperature, BP, urine output, coagulopathy, different arrhythmias, pulmonary edema, all those things we take care, and we monitor different modalities, and we manage the patients to make the circulation intact. Now, next question is, as a public or a general person, the question will come to us: how long can an organ survive inside and outside body in a decreased organ donation? So it depends. Suppose patient is on ventilator and support, patient is already declared brainstem death. Patient may survive even exactly. It's very difficult to say how many days patient can survive. It may be few hours, few days, even few weeks also. It depends on the how long the heart circulation maintain. And but our priority will be, once the recipients are ready and patient family has given the consent, as early as possible, try to retrieve the organs before patient deteriorates. So for that reason, there is a different timing. One, we call it as a warm ischemia time, another is cold ischemia time. So warm ischemia time is when the patient, once you clamp the organ, different blood supply. For example, you want to remove the liver. The liver, once you have to clamp the arteries, so blood supply to the liver will be stopped. You remove the liver till you put into the preservation solution. That we call it as a warm ischemia time. And most of the organs, they usually less than 30 to 60 minutes. Cold ischemia time, when you put them in the preservation solution, you can keep it for a longer time. So for that, cold ischemia time for different heart and lungs around 4 to 6 hours. For liver, it's 6 to 12 hours. Kidneys up to 30 hours. And intestine up to 6 hours. Pancreas up to 6 hours. These are for the cold ischemia time when you preserve them. If you don't preserve them, then it has to be within 30 to 60 minutes. It has to be, transplant has to be done. Otherwise, the organ cannot survive and it will be rejected by the body, recipient body. Now, what is organ allocation process in India? So as we have discussed, there are state nodal agency which is connected to transplant hospitals in different states, and they have their own website. The state nodal agency will have their own website. Hospital also have their own website with waiting list. So and all organs which is being updated by the hospital, automatically it will go to the state nodal agency, and the kidney and lung goes to the other hospital pool when a brainstem death is declared in a transplant hospital. Whereas other organs, as we have discussed, the liver, heart, intestine, and pancreas, which can be kept by the donor hospital. If they don't have a recipient, they can give to the pool. And the role of regional organ transplant, organ and tissue transplant organization and national, they have also tie up with state nodal agency, and they keep all information and connected, and all the data are saved, and all are medical legally active. Then what potential organ recipients need to know? The patient recognition is mandatory by the transplant hospital. The registration is required because when patient is registered in a hospital, only then transplant can be done. If patient is not registered, somebody is staying in Delhi and they want to go to some other Jaipur and they want to do transplant in Jaipur. So they cannot do like that, because if the name is registered in Delhi, it has to be transplant has to be done in the Delhi only and in that hospital only. So registration is mandatory in that hospital because it will go to the waiting list and verified for the transplant coordinator. And after fulfilling all the criteria, it is subjected to the waiting list. Hospital will call the recipient when suitable donor is available. And waiting time is too long in India due to the lack of decaged organ donors. Because we have a decaged organ donors are very, very less. The waiting time it's more depending on the organ. So we may get kidneys little frequently compared to other organs, kidney and liver, but other organs like lungs, it's difficult. Most of the time there will be some contraindications, or patient's condition will be some difficult to retrieve, or a heart, there will be some problem. It depends on the age of the patient. So some situations where it will not be able to give, but still for all the organs overall, the waiting time is too long. Because compared to that, as Srinivas sir also has mentioned, the demand is more and the supply is less. Now, what is situation in India, sir has explained already. It is because of unawareness and prejudices, huge shortage of the organs, and brainstem death due to the road accident is around 1.5 lakhs. Our organ donation rate is 0.86 per million, out of which Maharashtra is the top most donation rate, which is 2.5 per million, and followed by Tamil Nadu, it is around 1.8 per million, and then other states. But average throughout India, the donation rate is 0.86 per million. And the need of approximately 5 lakh organs per annum. Waiting list is very for approximately 1 lakh. Only 2 to 3% of the total demand is met. Just 2 to 3%, just imagine, of 5 lakhs is 10 to 15,000 only organ donation happens in India per annum, including all organs, which is much, much less as per the demand compared to demand. So this is awareness program. It's a awareness program. So for that reason, the government, different organizations like NOTO, the ROTO, and different state nodal agencies, NGOs, all this, they do a pledge. So because they request all the people, the nationals of India, they request pledge, because if you pledge to be an organ donor, the awareness once improves, and if anything happens, at least the family can give the consent to go for an organ donation. So pledging, it is very easy. You go to the website, you just register your name and other address and everything, you will get a organ donor card. So once you get an organ donor card, it does not mean that it is a legal entity. It does not mean that you have to donate the organ. It's not like that, because ultimately the organ will be donated or retrieved only after the consent from the kin or family. Otherwise, even though you have a card, that your name is registered. If we died, our organs cannot be removed without consent. So card doesn't carry legal entity. It is an awareness program, basically to improve awareness, so that we should discuss with the family. For example, I have given I got a card, but I have not informed to my family. So my family doesn't know that I am interested for organ donation. Then it is waste. So we need to discuss with family that yes, I am interested for organ donation. If anything happens to me, you can donate my organs. So there are some myths and facts about organ donation, as Srinivas sir already discussed. So what if I recover from the brain death? So the common question come to us, is there a possibility of recovery from brain death? No, it is absolutely, the fact is it is impossible. We declare brain death when there is irreversibility is there. So it means that brain death is an irreversible condition. It is different from the coma, because in a coma, there is some brain activity. Whereas in a brain death, no brain activity, there is no circulation to the brain. So somebody is declared brain death means there is no chance of recovery. Then the donor's family will have to pay more money to the hospital. That is also myth. The fact is, after declaration of the brain death, if you agree to donate the organs, usually the hospital bears all expenses till retrieval of the organs, whatever the supports are required. And another myth is organ donation mutilates the body. So once you remove the body from the body, the different organs from the body, it damages the whole body. The concept is there, but actually the fact is it's not like that. The surgeons give a single incision, and that to top of the chest to the navel, which doesn't disfigure the body at all. And also, since the donor's body is clothed for cremation, there are no visible signs of the donation. And at the same time, and forensic experts also will be available to see the organs, and the surgeons who are available there, they will see the organs. If anything is suspicion is there regarding the organs, so they can take it, they send for postmortem of the organs. So the organ donation does not mutilate the body. And there are certain things that can keep me from being an organ donor, such as age, illness, or physical defects. So you cannot decide for that. The fact is, whether which organ can be donated, which organ cannot be donated, as a donor, you do not know. You cannot decide for that. That can be decided by the person, a transplant surgeon, or a person who is taking a decision that that organ can be taken or not. That for that, one question arises: are there any conditions where a declared donor cannot donate organ? Are there any conditions? Yes, there are certain conditions where if patient is having active HIV, but or a patient is having uncontrolled infection, we call it as a sepsis, or a patient is having metastatic or non-curable cancer, or a past history of cancer, which is a risk for transmission. So those type of condition where if patient is declared brain dead also, he cannot donate the organs. So only these are few situations, absolute contraindication is there. And need to be other conditions, because we had something, age is 80, 75. Can you donate the organs? Yes, age is not a bar. I'm having hepatitis B or C or viral hepatitis and already treated or recovered. Can you donate? Yes. And acute kidney injury or acute renal failure, can I donate the kidney? Yes, acute kidney injury, you cannot donate the kidney. I'm having diabetes. Can you donate the organs? Yes, I can donate the organs. So these are the not contraindications to donate the organs if patient is deceased or declared brain death. So another myth is, once I become an organ donor, I can never change my mind. No, the fact is you can change your mind. Suppose you have given a pledge card, donor card. After that, you are thinking, no, I don't want to donate. You can change your mindset, and you can change. You can discuss with your family also that I don't want to donate my organs, so that if anything happens, they will not give consent. So that's what I want to say. Thank you very much for patience and discussion regarding the brain death.
Dr. Prushti, many thanks. I mean, like, I'm looking at all the messages which is coming in the message box that show outstanding response to your in-depth presentation, and that's what an expert makes a difference, they call it, they say. So I mean, we just don't have words to express our thanks to you for preparing such a wonderful presentation and making us aware of it. Next is only how we can, as a community, take it forward and have as many registrations as possible, because the figures which you narrated, 1%, 2%, that is dismal. We are such a populous country, and 5 lakh recipients we need in a year, and then we can't supply that. I mean, to me, it is shameful for all of us as a community.
Yes.
So we need to wake up. At least we should start from this presentation as an awakening. And I think we should all pledge, and as a mission, we at least pledge. And the next step is for our families to honor our pledge. Because at the end of the day, consent is to begin with the families.
Yes, sir.
Thank you so much. Thank you so much again and again.
Thank you, sir.
Satish ji. Satish
Yes,
ji.
sir. Yes,
Yeah,
sir.
please, Dr. Prusti, you can,
Yeah,
yeah,
if any questions are, please you can answer.
so next is question answers, right?
Yeah.
Yes, sir.
Yeah. So therefore, anybody, any question to Dr. Prusti, and he'll be happy to answer. Let us see if any question is there in the.
This is Dr. J. Sagar Prusti.
Yeah.
Presently, I'm working as professor and head of the department anatomy,
Yes, sir.
MKC Medical College, Berhampur. I am 2 years junior to Saroj Bhai.
Okay.
So definitely, this was one of the nice initiative by the organizers, and most of us were unaware, especially as a medical profession. We were also unaware what is going on with the organ donation. So that I'm very much thankful to both Srinivas sir and Saroj Bhai.
Yeah.
Both of them were so nicely presented that whatever unaware to us, we get to know. And as Saroj Bhai is the technical person handling all these issues, and he very much elaboratively presented the facts, lot of things. So there is no doubt about nothing to ask, because you have covered that each tit and bit of that organ donation. I think as a technical person, there is no more questions to ask Saroj Bhai, because he has covered everything very nicely. And
But-
I will take, I will discuss with him some other time, because I have decided I will present this topic on organ donation in medical college. We are having every month, we are having one that staff academic meeting. Before presenting this topic, I will take his 1 hour or 2 hour time in some other day, and I will clear myself, and I will present this first of all in my medical college.
Yes.
So I'm really impressed.
Yes.
Thank you very much.
Yes, sure. I'm ready to discuss with you. And
Yes.
first of all, most important thing I liked, I am happy, and I want to appreciate is choosing this topic by the organizing committee, Srinivas sir and other organizing committee. So everything, because very, very important topic. I liked it by seeing the topic. That day, Mr.
Ram Prasad.
So Mr. Ram Prasad Patra and Mr. Ganesh Prusti, so they called me regarding this topic. I was really happy. It's very, very important, because we need to be aware as a public, and everyone, we need to be aware, and that as Sir told, Srinivas Sir told, we should have a heart for giving the organs if something happens to us. So that concept should come to our heart and brain, I think.
Mr. Jamula Suresh, you have some question, right? You can unmute yourself and ask the question.
Thank you, sir. Just to before me, Dr. Sagar Pusti was talking to you. Sir, I have one thing as a non-professional man. Sir, you said 550 transplant hospitals in the country and 140 organ hospitals can be retrieved.
Yes.
Do we have in Odisha? And that was my first question. And second question is there any state nodal agency like Jeevan Dan Foundation in Tamil Nadu? Do we have any organization's nodal office in Odisha?
No, that I didn't go details about that actually. I need to find out, because just I know, because there are so many years I'm staying in Telangana. So I'm little more aware of the Telangana and Andhra Pradesh. Regarding Odisha, I need to find out. I don't know about that, which organization is working for that. But in Bhubaneswar, definitely there are our government organizations and the private organizations where all facilities like organ transplant, retrieval and transplants, both facilities are available in the private organizations. I know. So, so in those organs, those hospitals, they are being conducting, but the who is the nodal agency, state nodal agency, who is doing all these things, that I need to find out.
Thank you, sir. Ramprasad ji, you have a question?
Sure, sir, sure. I would first of all thank you, Dr. Saroj sir and Koti sir, for the excellent session on organ donation. So the day I reached to him, so he was so glad at that. I really want to do that for the community. So really grateful to you, sir, Saroj sir, for this. So okay, so let me and also not the least, thanks everyone to join this session and take the benefit of the sessions. So my question goes like, sir, as a layman, I don't know much about the things hospitals and organs, how to do that and all. So first thing it comes to on my mind, like if at all I am interested to do that, so whom should I reach first, and what is the first step to do that?
Which one? For organ donation?
For organ donation.
No, organ donation, one is live organ donation, that is different. Another one is a decayed organ donation. So decades only after our death, it will be the organ can be donated. So that's what we need to pledge. Pledge means at least if we register our names that I'm interested for organ donation. So that can be done online. So we'll get a card, donor card. That is, it's only for awareness, that doesn't has a legal entity. So as a awareness, yeah.
Ramprasad sir, in a very simple manner, we have to go to the Noto website and pledge our organs. The card would be there. Let us keep that card in a purse. When we die, a family would definitely look at the purse and see that we have pledged our organs. So I don't think anybody would have a heart not to honor our own commitment. Our families would definitely fall in line with our commitment. Dr. Prushti, is that the right approach?
Yeah, yes, sir. Yes, sir. That is the right approach. Yeah, that is best way. We keep the card in our purse, so that will be helpful. Yeah, that will be.
So let us do that. Let us generate more cards in more purses, because all of us will not die at the same time. So, but then as and when our station comes, we can at least leave our legacy by doing at least this much.
So is it one-to-one basis, everybody in our family has to separate card for everyone, or it can be a one card for all the family members?
No, each individual will have a separate card.
Separate card. Okay. Yeah. Thanks for the info, sir.
Thank
you, sir, and
Mr. Ankit Prushti has got a question.
It is not Ankit Prushti. I am his father. I am Dr. Ganesh Prushti. Sorry.
I'm sorry.
In fact, I'm using his laptop.
Okay.
I'm a layman in medical field. Still, I would like to know, I have taken place now. What is your suggestion? Like I'm asking to Dr. Saroj Prushti only. What is your suggestion to simplify the process for donation?
No,
what is your suggestion? Like a government has made all the process so that it is
it's
watertight. What is your suggestion so that it can be simplified still?
No, it's
only 2 to 3% people are getting benefited from your presentation. I can know.
Only 2 to 3% are being benefited, but the remaining things are not benefited because one is the failure, because how many brain deaths are being declared and refusing by the family. The family are not able to sign. The conversion rate, we call it as a conversion rate. The conversion rate is low, but it has improved compared to, suppose if you look at 5 years back, and now there is a lot of improvement compared to the 5 years back. So people the awareness is increasing, and those people who are saying no, now they are saying yes, I am ready to donate the organ. So the family are ready to donate the organs, but still the conversion rate is low. so that our decreased organ donation has to increase. So it is kind of, it's nothing to do overnight. It's a matter of time. So once awareness improves, if something road traffic accident happens and somebody has decreased, so in that situation only it will happen. The situation, the things will come.
So you meant to say we should encourage all the NGOs to educate people so that this process is simplified.
Yes,
It's not
only,
government's fault.
yeah. It's a
Thank
not a,
you.
yeah.
Yeah.
Thank you, Dr. Saroz.
Thank you. Thank you.
Mr. KGK Patro, you have a question, please.
Sir, I have one small doubt.
Sir.
In case of natural death, suppose just old age, say 80 years, 85 years, that time it is neither brain death nor cardiac death. Then
Yeah.
it's just a natural death. Then
Yeah.
how, whether organ donation is possible?
No, the organ donation, it is not possible because natural death, you cannot retrieve the organs from the body because all circulation has been stopped and the cardiac pumping function has been stopped. So no organs are viable now. The only organ which can be retrieved after natural death is cornea. The cornea means eye donation. We call it as eye donation. So that is possible within 6 hours. Suppose when we say patient has declared death this point of time. So within 6 hours, we can take the cornea, both cornea, and donate to the eye hospital. They will take care how to proceed further.
So that means whatever donations you have been speaking of, it is all mostly accidental deaths. If it is deceased donation.
Yeah.
So basically,
yes, because there needs some certain etiology should be known. For example, somebody had a cardiac arrest in the hospital premises, which is a witnessed arrest. Example, I'm saying. So because of cardiac arrest, there is a loss of circulation to the brain and patient has died. So in died means the cardiac function is intact, but brain function is gone and circulation is also gone. The brain circulation is gone. Patient is in comatose condition. You know the cause. You can say you can proceed for organ donation after a certain period of waiting period. And if you don't know the cause, for example, certain situations, as I given example also, patient is comatose condition, but cause of coma you do not know. Suppose some viral encephalitis, I told you example, viral encephalitis, patient presented with viral fever, becoming unconscious, then becoming brain dead. Now family wants to donate the organ. In that situation, when we don't know the cause for the brain death, in that situation, we cannot proceed for the brain death process. So for that reason, most of the, if you look at the data, most of the centers, the brain deaths are being means we proceed only means particularly accident cases, because it's a clear-cut history that patient had an accident, injury to the brain, and patient had brain death.
thank you, sir.
Mr. Jamula Suresh, you can unmute yourself and ask the question.
Thank you, sir. You said through online.
There is one more Jamula Suresh.
No, sir. I am using laptop and mobile because of some technical issue. Okay. Sir, you said that through NATO or what you say, NATO, we can register, we can pledge. Sir, being a resident of Barampur in Ganjam district of Odisha, if I hold that card after my death or somebody's death, how can we make the organ donation? It is 170 kilometers away from Bhubaneswar, sir. No doubt there is I said at the very outset, I said it became a tradition after death, eye donation is going on. We can take initiative for organ donation, provided it should be a proper infrastructure in and around Barampur. Sir, do you have any suggestion for that so that we can initiate? No doubt we'll start pledging the organ donation.
No, sir, you are right. Your question is right. The thing is, we need a proper infrastructure, because unless we have that facility to support the organ, when brain death is there, we need to support the other organs by giving all supportive measures like mechanical ventilation, for BP supportive medicines, different other organ supportive medicine, IV fluids, all these things to sustain the other organs viable. it has to be in a proper hospital. So decreased or brain stem death declaration should be in a hospital. Then only you can retrieve the organ and you can proceed further. Suppose it is not a transplant hospital or a retrievable hospital, you cannot proceed with all these things. So maybe these things not possible in a center where these facilities are not available.
But then the infrastructure might be improved in the years to come.
Yes.
So pledging ourselves is our intention.
Yes.
Now,
yes.
if the infrastructure is not there, that's the country's loss. But then we should continue pledging. Sometime, let us hope that such kind of a facility comes to your doorstep or in your city. Let's hope so.
Yeah, because now government also is trying to improve the different medical colleges and other centers also for improving the infrastructure and giving the organ donation, because retrieving the organs there in the same government organizations, and transplant also. So probably over a period of time, the different medical colleges, even other remote areas in Berhampur also, suppose MKCG comes with all those facilities. So probably you can be able to do in Berhampur too.
Sir, I'm very much thanks that our Dr. Sagar Pushti has joined. Definitely, he will take initiative. After he became the HOD Anatomy Department, 17 body donations took place, sir. Definitely. Sir, in the year 2000, eye donation was started in MKCG. After 5 years, the eye department became the eye bank because of one organization called French and Play Club. I think with the support of Dr. Sagar Pushti, we will take this initiative. And he has assured that there will be again a meeting in the MKCG, sir. Thanks for this Zoom meet, and Dr. Saroj, sir. Because of your presentation, Dr. Sagar Pushti become, inspired to organize a meeting in the MKCG. And thank you, sir.
Thank you. Dr. Sagar, please call Dr. Saroj to the college back and let him also be along with you, motivate.
Yes, sir. Definitely. I will try my level best to organize such kind of meeting in medical college, because most of the persons is technical, and most of us, all doctors, I think 99% doctors are unaware what organ donation is. Okay, definitely we'll organize the meeting.
Sir,
with Dr. Sharma,
one more suggestion, sir. Since you are from the profession, if you can take an initiative that in the medical courses, in the MBBS and the postgraduate courses, there should be a paper on organ donation for all the upcoming doctors, so that then they're aware of it. They're ready-made for the organ donation canvas. If you can just write to the Medical Council of India and the Health Minister as doctors on behalf of your college as a suggestion, or through your local MP, it can come in the form of a provision in the Act itself. Kindly take those measures, sir. You're saying will have a bigger impact than we as laymen.
Yes, sir, true. Actually, it's a highly important point. Very important point you have put.
Thanks, President, sir, for your nice suggestions, sir.
Thank you, sir. Thank you. Any other questions?
Hello, I am Dr. Raju from Orissa calling. Just I have one question. What is the cost effective for arranging this organ donation for the patient at the center to set up? What would be the cost required for the institution to establish one organ donation plan storage?
Dr. Saroj Pushti, you have to answer.
No, it's sir, actually different departments, and one is retrieval of the organs. Doesn't need anything, because only if your center it has to be approved by the state nodal agency and NATO national agency. If both approve that hospital for retrieval of organ, then your expenses or cost for establishing the center may not be much. But if you want to transplant in the same center, you need all the departments. You need transplant centers for kidney transplant, liver transplant. All the things should be conducting in the same hospital, so that after retrieval of the organ, those things should be done in the same hospital. or only retrieval center, you just remove the organs, keep in a preservative solution and send to the centers where the things can be transplanted. So the cost will be much less if only it is a retrieval center. But for transplant center, you need more, all well equipped, even the operation theaters, everything, all staff, all the different department consultants, everything you need.
Sir, is it Dr. Raju of Parla Committee, sir?
Yes, I am Dr. Raju, working at DPHO at Raigada.
Sir, this is Jamla Suresh. You know me very well, sir.
Yes, sir, I know you, sir. Thank you.
Any other questions, please?
He is our basement only.
Yeah, okay.
Sir, I have a small question.
Yes, sir.
Nowadays, I think recently I have heard that.
Can you introduce yourself, sir, first?
Sir, myself Satish Kumar.
Ah.
Yes, sir. I am working in the Sun Pharmaceutical Industries Limited. Sir, I have a question. When last 10 years, 15 years, there is a lot of campaign that when child born is process, in the child born process, the umbilical cord can be stored. That is stem cell storage. It is a plays a vital role in India. What they do, the umbilical cord stem cell they get stored in a separate at a particular temperature of -50 degrees, so that later stage that can be regenerate the organs, and that is a process is there. So that it is not related to somewhat current topic. Maybe just I want to have an idea how it can be useful if anyone want to go that process.
Yeah, no, it is a stem cell transplant. We need to, the people where suppose I am interested for stem cell. I know because for example, in a family, some genetic disease is there. And I know that if my parents are having, I am very prone for that disease. So before occurring that disease, suppose if my stem cells, if I preserve it in a center where it can be preserved, I donate the stem cells. The disease, when it happens after certain age or certain time, so again, those stem cell treatment can be given to the patient for recovery of the patient. So that's what the concept. Basically, the same patient or some other patient, if there is a matching and different the cross matching, HLA typing, whatever for that also, if it is possible, that might be done. The exact procedure I don't know. We have to find out regarding the stem cell transplant.
Any other questions, please? Yeah, Mr. Satish, you can just roll over to the next slide. Yeah. I mean, the secretary and joint secretary, you have any updates for the meeting today? Ram Prasad ji, KGK sir.
Yes, sir.
Yeah.
Thanks everyone for attending this session. This is Ram Prasad Patro, Secretary to KVS Delhi. So, I would like to thank you everyone, attending the last session of ours, on 26th March, we have done also wonderful session on Ugadi and Ram Navami. So we really thanks to everyone, participants who all are, given their entries for the competition. And really glad to, have all those competitions, and congratulations all the participants and the winners. So I would like to announce, we are also going to have this kind of session, in future as well. We are planning a career opportunity on legal, and also one session on yoga. So we are just planning in future months, to have those kind of sessions. If anybody
wants and liking on those kind of topics, and our community, like kids, can have that career opportunity on legal things, so that they can have that kind of opportunity to attend those sessions and take the benefit of that. So, and nothing as of now, Putney, for for the treasurer part of things. So, so last time we have already announced that, so nothing much difference happened to that. But yes, again, I would like to thank the sponsorships and donations given to the Samaj. So really glad to receive all those, and that definitely we are going to use it in a better way. So I also request everyone, if possible, make yourself as a KVS member, daily KVS member, join us, and definitely we'll make a great things in future. So yeah, thanks everyone.
I mean, on behalf of Ram Prasad ji, I'm again trying to say that, sorry, we want to have a national character for our KVS Delhi NCR Samaj. So and then we intend to continue with these efforts. So any of you is willing to become a member, we'll be happy to assist you in the process. And also your suggestions on speakers, on topics, on anything which may be of benefit to the whole community as such, we'll be happy to get your support, sir. Yeah, thank you so much, Ram Prasad ji. Satish ji, can we get to the next slide if there's anything, recognitions? Ram Prasad ji, any recognitions this time?
Okay, sorry, I just missed that. No, so we are going to just in process of circulating the certificates of the last event. So
Right.
that's where we have planned. Yep. So nothing
So
much.
just for those who might be wondering what these recognitions are, so we are trying to motivate and also call out talent from our community through various competitions and various kinds of events which we organize online and offline, and also the achievers in our community whom we call for motivational speeches and also on various topics of career development, etc. And we recognize them through different kinds of awards to I mean, as a mark of our gratitude. So this recognition is in that context. So today we would like to recognize Dr. Saroj Prushti for coming in and then making such an impactful presentation. Dr. Prushti, we would come back to you with the citation and other things on one-to-one basis after the meeting.
Yes,
So,
sir. Thank you, sir. Thank you very much.
Thank you so much, sir.
Thanks, sir, for accepting the request for the organ donation topic. Yeah, and
Satish ji, next slide, please. Yeah.
So Kotniji, in fact, actually, we thought of doing some kind of more activities in this one, but I thought to take most of the opportunity to get more information from Dr. Saroj sir and you. So I didn't keep any more other activity.
No, that was wonderful because it was right. It was a focused one, and then we need to multiply this effort. Through at least pledging first, and then also wherever possible trying to promote organ donation. So with this, I'll hand over the stage to Dr. Ganesh Prushti, our Vice President, for the vote of thanks.
Thank you, sir. Good evening, my dear KVS participants. I'm Dr. Ganesh Prushti, Vice President of KVS Delhi NCR. Today, on the day of Akshaya Tritiya, we are gathered to know how to look for organ donation after we lose our existence in this earth. All of us know we have come to earth without anything in our hand. We are fortunate to we can donate our body parts before our death. We can take place at least. I would like to thank all of you during this vote of thanks ritual. First of all, like I'm thankful to all, in fact, as rightly said by Mr. Suresh, like our community people are more active, are more enthusiastic for like a body part donation than any other people in this, at least in Odisha. So I'm first of all, I thank all the doctors and surgeons of our community, those who are pioneered in this field to help us in taking the place. Uh, Secondly, we are indebted to Mr. Courtney, our president, for his multifaceted talent. He's a CA, he is an advocate, then he is knowledgeable in every field. His lecture was really excellent. His able guidance and required support from Mr. KGK Patra and GP Rao has led us to such societal missions. In fact, we can do Mr. Ram Prasad, our secretary, and Mr. Ashok Boyana, our treasurer, are the driving force in materializing the things. We are thankful to Mr. Saroj Prusti, who has given such an excellent and lucid presentation of like how to donate. In fact, he is my cousin also. For delivering this lecture, he might have taken a lot of effort, but it implies like how really he is motivated to do such like a societal mission works. He could let us know all the intricacies of organ donation, from the process to how to take place and everything. In fact, we also have some doctors like Dr. Sanju, Sangita Subudhi, and some more doctors are there. I may not be remembering their names. They are also equally talented, and I'm thankful. I'm happy that in future, if we do that type of like pledges, they will help us in materializing the things. I also thank all the silent workers who have made this event lively. Once again, I thank each and every one who have attended this meeting and encouraged us for arranging such events in different topics. Let us go for more and more societal missions without physically spending much. We need not to spend any money, but here we can donate our taking place for donating our body parts. Now this floor is yours to contribute more for this for the upliftment of the society. You can have more discussion, but right now on behalf of management committee, I would like to say we do not have much to contribute right now, but definitely the floor is open to all of you for further discussions. Thank you, sir.
Thank you. Thank you, sir.
Thank you, sir.
Satishji, we can stop sharing the screen so that informal interaction can happen.
Yeah.
Sir, can
Okay.
I take opportunity?
Who is speaking? There's some echo.
Sir, there was a suggestion.
Manoj Kumarji, who is talking?
Myself, Manoj Kumar Subudhi,
Yeah.
working in Indian Railway Chief Engineer at Bilaspur.
Oh,
It was a really very nice and informative presentation, both by yourself as well as by Dr. Saroj Prusti.
thank you so much, Manoj, sir.
I had some queries, but somehow I got to know from the questions from other friends. So I have, but in future I may have some queries. So I requested if I can get the number of Dr. Saroj Prusti, I may contact. And I am very much interested on this topic. I was very curious on this topic. I have, but the only thing I came to know today itself that a natural dead person can only donate cornea, nothing else. So that is very painful, because I was thinking a natural dead person also can donate other than cornea also. But sorry to get to know that we cannot do that. Anyhow, but even cornea donation is good enough. People, so my long wish was there. I will also promote, to start with, I will promote from my family WhatsApp group, then my engineering college group. Like that, I was very much interested. If so, if any assistance is required in that respect, I may request you as well as Dr. Prusti for help, because I want to promote this at least in my reach, in my office, in my family, in my friends group, etc.
Manojji, many thanks for your volunteering to come forward. And then look, if you can become a organ donation warrior, that will be a great carry
No,
back
no.
from this particular
It
session.
is my long wish, I can say. It is my long wish. The
I mean,
only thing, it is not getting materialized.
Now it will get materialized. You have common platform here, and we all have a similar kind of a mindset. So you wanted Dr. Saroj Prusti's number. Dr. Prusti, if you can.
Yeah. You can write down. If you...
Yeah, Ram
Sure.
can you write it in the chat box, Dr. Saroj Prusti's number, for anybody to reach out? Sir, if it's not a problem.
Can repeat also.
Yeah, you can say it also.
94407.
Okay.
21690.
41.
21.
21690. Okay. 94407 21690.
Yes.
Actually, I got this information.
Also.
Yeah.
It is about Dr. Sagar Prusti number, na?
It is Saroj Prusti. My number.
Saroj Prusti.
Acha, this is Sagar Prusti.
Sagar Prusti also number is given in the chat box.
Yes.
Okay. Actually, I am thankful to Dr. Ganesh Prusti, Mr. Ganesh Prusti. He has only informed me about this program. Otherwise, I won't have been able to know about this webinar. So I thank to Sri Ganesh Prusti.
You won't miss it. Just become our member.
He is my brother.
I know. I came to know from him that I thank him also for that.
Thank you so much.
Thank you.
When I am also, I think I am not registered. My name also should be registered, sir.
Sir, I mean, we'll send the form to you. Ram Prasad ji would get in touch with you, sir.
Yeah,
because
yes.
that way what happens is that we'll be in touch with you for many other things.
Yeah, sure.
And then we can keep taking your what you call guidance on aspects which may be of societal interest.
Yes, sure, sir. Most welcome.
Sir, one question, sir. As you told, 1.5 lakh road accident deaths. What is the approximate percentage they come to the category of donor?
That's what, out of 1.5, that's what the transplants are happening around 10 to 15,000 in a year total. 10 to 15,000 in a year.
Sir, what I mean, if you look at the statistics, out of every 10 lakh people, only one person is donating.
Yeah.
If we have 10 lakh population, only one person.
Yes, correct.
No, I'm not talking in the terms of population. I'm talking in the terms of number of road accident deaths. How much?
Yeah, that's if you take total organs, the total organs around 10 to 15,000 in a year per annum. If you take 1.5 lakhs road traffic accident happening, out of which total donations, total transplants are happening around between 10 to 15,000 in a year. It's 2 to 3% of the 5 lakhs requirement.
One more thing, as you told, this is organ transplant is possible from the brain death or road like that, brain death persons. But cornea transplantation is possible from the natural death persons also. So why cornea transplantation is not on the higher side? Why such deficiency in eye donation also?
No, the cornea, the ratio is very less because the requirement target is around 1 lakh per annum cornea transplant, but it is happening around 25,000 per year. the cornea transplants is happening 25,000 per year. So it is almost your required target is 1 lakh, but still it is around 25,000. So probably the still awareness is required for the corneal transplant too.
That's what my concern was. At least cornea transplant should be able to fulfill the requirements.
Yeah. So that can be improved a lot, because it's
Yes.
when cardiac deaths also, whatever happening at home or in the hospital, within 6 hours, if we were able to retrieve the cornea, that would be much better.
Okay. Thank you. Thank you so much.
Thanks to the organizers for the selection of this topic. And there was a suggestion for a yoga. And may I suggest on this August gathering, can we initiate prevention of our environment? It is a need of the day throughout the world. Can we take some initiative? We are working on the single-use polythene, not to use single-use polythene. We are working on this last 7 years. I think let our community take some initiative through this Zoom meet, the prevention of the environment.
Sir, I mean, we will do a session on single-use plastic and steps to for environmental protection, provided you ensure that at least 150 people join the meeting. If you promise,
we can work it out. If it is
that's the only thing. I mean, we will do a presentation, we will do the entire research, and we'll get the right persons also, and we'll do in impactful manner. But then we should have a reach, because if only 20-30 persons are coming for such valuable sessions. It's also painful sometimes, because if we have an entertainment program, then there'll be 500 people, right? Or if there's celebrity, there'll be a number of people. But such kind of topics we are not able to attract, except for those very, very committed people.
Sir, other than our community, can you accept?
We can have no problem as attendees. They can come. They can't become members of our community, of the Samaj, but they can definitely participate in these sessions.
Then there is a green man called, if you Google it, you can find Mr. Sudhir Raut of Ganjam district near Chikiti. He is the green man of Odisha. He is working since last 12 years. We are also joining with him. If we can make him a speaker, if you allow us, so that a good number of people also, other than our community, if you allow us, they will also join on the environment.
Definitely, sir. We'll have a discussion in our governing body, and your suggestion seems to be very, very promising. So we would definitely come back to you. So, I mean, who has invited you, sir? Dr. Prushti?
No, Ganesh Prushti.
So therefore, he'll only be in touch with you.
Yeah.
Okay.
Yes.
Now, before you take a decision, just Google it, Mr. Sudhir Raut, okay, of Ganjam. Sudhir Raut.
Could you please type out in the chat box and the number also?
Yes, sir. Yes, sir.
We can keep a record on that.
Just please allow me, give me some time. I will get it.
Sure. And also to answer.
And also, if you have any, if you have any known environmentalist from our community, kindly suggest that person also.
Sir, I have few persons in my mind already, like Dr. I think Satya. I don't remember his name. He's from Bhubaneswar. And one more person already we have, like Sanjukta Subudhi.
Yeah.
Okay, so she can also give a very good topic.
She's an environmental scientist.
Right. So we have already a very gem of,
because we need to have people from our community also. And then as suggested by Suresh, sir, we can invite this gentleman from Chikati, Dr. Sudhir Raut.
Sir, you might aware that PSN Patro now is residing in Bengaluru. His brother, and again PSN Patro is the Odisha State Environment Society president. You can also invite him. He is staying in Bhubaneswar.
I was talking about him only, sir. I know him very well. I can get in touch with him.
His daughter.
So let us make a panel discussion. Suresh sir, can you work with us in finalizing the agenda and the topics for the panel discussion on environmental protection?
Definitely, sir. Definitely.
So I mean, we would request you and Dr. Ganesh Prushti to just discuss these names. I have noted them down. Even our Ram Prasad ji has noted them down. But then let us package it together and then do one on plantation and other single-use plastic and other environmental protection measures, which can, I mean, otherwise we are all, I mean, we are on the last leg of our planet. I mean, sorry to say, but we are not recognizing that, and the climate change, what is happening, and the kind of environment we are leaving for our next generation. Like I'm sure that pains you also. That is the reason why you suggested that. It's an excellent suggestion, but we just need to design the event.
Sir, regarding technical part, I may not be the right person, but I can guide you. There are the people in Barampur of Ganjam district regarding the technical part and other things. They will definitely, we will work together, sir. No problem.
Absolutely understood, sir. Technical part, the panelists will take care of, but we need to put together a program. We need to give a subject. We need to put the time. We need to put all that together. I mean, all these events take some effort on our part to put them together. They look simple when they are executed, but behind the seen's, a lot of work happens, sir.
Okay, sir. I will talk to PSN Patra of Bhubaneswar, who is the
Please,
president, and then I will let you know to the Ganesh Prushti, sir. Okay, sir.
Right, sir. And you can also take my number in case you can connect with me anytime. Ganesh Prushti has got my number. So
Can you please tell your number, sir?
98
98
11
11
28
28
28
28
63.
60. Sir, here in Delhi,
I'm in Delhi only, sir.
Okay, sir.
I would request, like, please do not disturb PSN sir right now, because I don't know whether you know about the information, like, his wife passed away recently, so we don't want to disturb him right now. So,
so that I'm not aware, sir.
Right, so that's why we can just have a word with him maybe after 1 month or something, just to give him some time. So,
Ram Prasad ji, he is a passionate man, and he would definitely be happy if we connect with him. He may say that, look, I'm busy with this, but it's better to close it.
Right, but it is happened.
Not let him grieve.
Yeah,
this is the best way. By talking to us about environment and protection of environment, his grief will reduce.
Sure. Yeah, I'll also talk to him regarding that. Yep.
Yeah. So you can message him and then find out the right time and then talk.
Sir, if you allow me, I will add your number to the Aryabhatta Foundation, which is working for environmental, and PSN Patra is a member of that. Every day is to give a morning mantras about environment, sir. So you can go through him, you can understand, then we can have a meeting, sir. No problem.
Sure, sir. Thank you so much. I think we had a wonderful session. So the weekend has come to an end, but then, yes, I'm sure some of us will definitely become what you call donors, or at least will indicate our expression of interest and take our cards. Let us hope so. And let us take a count from today onwards. How many people in our circles have filled up the form, right? Keeping that count also will keep us motivated.
Yeah. Yes.
Thank you, sir. Thank you. Have a great evening, all of you.
Yeah.
Bye. Thank you.
Thank you all. Thank you very much.
Thank you, everyone. Thank you.
Sir, all of you are invited to Barampur Thakurani Jatra, sir. It will be ended on 1st of May.
Yeah.
So we'll plan around that, sir.
So it is continuing now.
Yeah.
Sir, 4th April to 1st May, sir.
Yeah. Okay.
So we all miss that Barampur Thakurani Jatra, because during our childhood, we used to enjoy that for quite so many
Sir, I will be get in touch with you frequently right now.
Yeah.
Maybe we will require you for our community. Okay, so more topics.
Yeah, sure. Anytime if anything is necessary, please.
Okay.
Thank you.
Thank you.
Thank you.
Thank you all. Thank you all for making this event great.
Thank you, sir. Special thanks to Ganesh Pushti for inviting me.